Hi, my name is Amanda Laters-Ozarowski, and I'm a certified genetic counselor at Good Samaritan Hospital Medical Center in West Islip, where we are proudly celebrating the 10-year anniversary of our genetic counseling program. Today, we'll be reviewing 10 common myths about cancer genetic counseling and testing. Myth 1: if I test positive, it means I have the gene. In fact, we all have the genes that we are being tested for, and these genes are supposed to protect us against cancer by producing a protein that performs DNA repair in our cells. If our gene is mutated, it cannot create the protein properly. DNA repair does not work as well, and cancer risk is therefore higher. Myth 2: I don't need genetic testing because I already had cancer, or I already had cancer genetic testing. In fact, while you may have managed your cancer risk by having both breasts removed if you had a prior diagnosis of breast cancer, there could be other organs of your body that are at risk, and cancer genetic testing can help you to understand that better. Also, genetic tests are constantly evolving, with technology improving and more genes being discovered, so your prior genetic testing may now be out of date and you may require an update. Myth 3: genetic counselors force you to get genetic testing. What's shown on the screen is the definition of genetic counseling from the National Society of Genetic Counselors. And while a genetic counselor will discuss genetic testing with you and educate you about that option, that genetic counselor will never force you or require you to have it done. Myth 4: anyone who has cancer in their family should get genetic testing. Not true. Only about 10% of cancers are inherited. And at this time, we only recommend cancer genetic testing for people who have a personal history or a family history that's suggestive of an inherited cause. Who should consider genetic testing? Anyone with a strong personal or family history of cancer, such as cancer diagnosed at a younger age than average, multiple cancers of the same type in one family, or some rare cancers that are occurring in a family. If you're not sure if your history is strong enough to get genetic testing, I highly recommend that you speak to your doctor or your healthcare provider about the option and perhaps request a referral to a cancer genetic counselor. Myth 5: genetic counseling is a barrier to genetic testing. Yes, genetic counseling does require an additional visit after your visit with your doctor or your healthcare provider. But genetic counseling can provide a lot of valuable benefit to you. Number 1, making sure that the right and most comprehensive test is ordered for you. Also making sure that you are fully educated about the test you're about to receive and that you understand what your family history and your genetic test results mean for you specifically within your family history. Myth number 6: all labs and genetic tests are equal in quality. Most definitely not true. There are a variety of laboratories and genetic tests out there, and all of them differ in many ways. Sometimes their technology, sometimes the number and type of genes included on their test, and even their interpretation of their results. While we could talk about this all day, my tip to you is if you're going to proceed with cancer genetic testing, that you work with a healthcare provider who is experienced in this field. Myth number 7: genetic testing can cause me to lose my insurance. In 2008, our federal government passed the Genetic Information Non-Discrimination Act, called GINA, like the woman's name for short. GINA makes it illegal for health insurers and our employers to discriminate against us using our genetic information. If you're interested in learning more about what this law protects you against, I highly recommend that you go to ginahelp.org. Myth 8: if I test positive, my family members will test positive too. In fact, most hereditary cancer syndromes are inherited in an autosomal dominant manner. That means for someone who tests positive, each of their first-degree relatives, such as their siblings and their children, have a 50% risk to also test positive, but a 50% risk to test negative as well. Myth 9: if I test positive, my doctor will make me remove my breast, ovaries, colon, pick your favorite organ. That's not always true. It is an option. Preventative surgery is a choice that some people will elect to move forward with if they're found to be at high risk for that particular type of cancer. But it's not the only option. There's the choice to do more sensitive screening or more frequent screening for that type of cancer. Sometimes there's even medications that can be taken to reduce cancer risk. Myth 10: if I test negative, it means I won't get cancer. Most definitely not true. Negative results reduce the chance that you have an inherited cancer syndrome, that 10% we talked about earlier. They do not eliminate that chance. If you have a strong personal or family history of cancer, you still may have a higher than average chance to develop cancer. In that case, extra careful screening and sometimes preventative surgery are still appropriate for you. In addition, we all have a risk to develop environmental or sporadic cancers, and genetic testing for hereditary cancer does not address that risk. I thank you so much for your time. I hope that reviewing these 10 common myths about cancer genetic counseling and testing helped you learn a little bit more about this process and the truth behind it. I encourage you to contact our office by phone or visit our website if you're interested in learning any additional information about cancer genetic counseling or testing.